Well, it's a disease that isn't talked about very much, but getting a little bit more play now. Cervical cancer, obviously very serious. Last year, 12,200 new cases of cervical cancer were diagnosed. Also last year, 4,210 women died from the disease. Joining us this morning to answer some questions about cervical cancer, Dr. Salem, a Salem Oncology Center. Good morning to you.
Good morning to you.
Thank you very much for coming in. And let's first talk basically about cervical cancer. What is it and how can we prevent it, first of all?
Well, this is a disease which is caused by an infection. The infection is by the human papilloma virus infection. This is a model of how a repeated infection can eventually lead to cancer. And fortunately, now we have a vaccine that will prevent the infection, and consequently, it will prevent the cancer.
Now, when the HP vaccine came out, obviously very controversial because it's dealing with younger girls that can start with it. So let's talk about that. And this has been going on for a couple of years. So we've seen some results in this too. So let's talk about that.
Well, the vaccine has been around for approximately 4 or 5 years. And in my opinion, all girls and women between the age of 10 to 30 should be vaccinated, because if they receive the vaccine, we can prevent 70 to 75% of all cervical cancers, which in my opinion is a major progress.
Absolutely.
And we do not have major toxicities. This is a relatively safe vaccine.
You know, years ago, this used to be maybe dubbed as the silent killer, cervical cancer. The best way to know about this and where you are with this disease and your chances of getting it is you have to get a pap smear, correct? That's the only way to really detect?
Sure. Pap smear is the best way to detect it, and all women above the age of 25 should undergo screening by pap smear. But we can prevent 70% if we vaccinate all women between the ages of 10 to 30, and the 30% that might develop the disease could be detected early by the pap smear, and then the prognosis will be excellent. In fact, if we apply the knowledge we know about cervical cancer, we implement it in health policies, very few women should develop cervical cancer.
We'd like to hear about that for sure. You can find out more information about cervical cancer, see a replay of this interview, all under the hot button for you on click2houston.com. Doctor, thanks for coming in. Great information this morning. Do appreciate it.